This session is going to cover a running locking suture. This suture, I think, allows you to have less tension on the tissue. In a traditional running suture, sometimes you might be able to pull too much tension, and truly a running stitch doesn't allow for that much tension on the underlying skin. So similar fashion to other running stitches that you would have thrown, if you are a right-handed suturer, you're going to start from the left and pull to the right. So again, this starts as any other runner does, with that simple, essentially an uninterrupted suture. Again, this is a longer proline, probably not the length that you would have doing this stitch. And again, here you can simply proceed with a single tie, hand tie, a two-handed tie, or you could do an instrument tie. Any would be appropriate. I simply prefer a one-handed tie. Now, similar to a runner that would be defined as a whip stitch, and just being easy in terms of rotating that wrist around to throw that stitch, the only thing that changes with a locking suture is what you do with this other end, because traditionally you're very cautious to not ensure that you are through the loop. For this one, you actually will, on purpose, go through that loop, and that is what will lock the suture into place. Now here is my loop, just draw some drama to this. I would want to traditionally with this suture or with this suture ensure that the loop was opposite, correct? I'm going to ensure that I actually go through that loop. So make sure that you kind of have control over that proline or whatever you're using, a PDS, and you're going to lock that stitch in place. Now, one thing that you'll notice is if initially as you get started, you pull and the lock is going to end up happening on the bottom, you can certainly just simply rotate your knot to the inferior aspect, and that way you're going to be on that same side. We'll go through a couple of these just to re-demonstrate that locking mechanism. The nice thing about this stitch is I find it easier, I should say, to make relatively symmetrical. Again, here's my loop, and I'm going to make sure that I'm staying locked. Again, I think you have a less likelihood of causing injury to the tissue itself, and they're very easy to take out. I liked closing all of our craniotomy incisions in this fashion. If you end up needing to CAT scan that patient's head post-operatively, this caused no artifact, where you can imagine that if you had multiple staples in place, certainly you would have artifact present. This eliminates that. So pulling out, ensuring that here's your loop, you want to make sure that you pass underneath that loop as you pull out your suture. So again, kind of sometimes that proline and even that Epsilon, a lot of these have a lot of memory when they come out of their packaging. Just ensuring that you're locking that in place. Again, when you're going to go to remove these, I simply cut at this section, essentially along the straight line, and that is certainly less painful for your patient. And again, less debris that you're potentially pulling through the wound. So for the sake of brevity, I'm just going to throw one more, and that way we can discuss how to close this. Again, it closes similar to other running sutures, except what I don't do at the end when I close this is I don't lock this. I simply use this here to tie. So I'm just gonna do a one-handed tie now with my left hand, and what you'll find is, see how without locking that, it definitely pulls that stick, keeping it in line with the other area. And you can kind of adjust the tension that you put on this, and that way you don't pull too tight on the tissue. Again, then you would cut these 3 once you completed your 6 hitches total. I demonstrated 4 there. You would cut the 2 loops are going to cut as one. And you're going to cut your other tail. And then you're going to have your nice runner. And when you go to remove these, if you simply pick up at the juncture and cut each little line across, you're going to need to cut adjacent to your knots. You're just able to pull all of that material through. Again, less debris that's being pulled through the patient, so you have a less risk of injury to the patient. These come out very easily. These hold a little bit better tension than even just a runner if you were to go over a joint space. However, again, remember that traditionally over mobile segments, we would recommend that you use interrupted sutures, and that way, if there was too much stress placed on that wound and one suture popped, it would be only one suture that would potentially be problematic, and you would essentially not unzip the line of your running stitch.